So in this sideline technique, we're going to work the iliotibial band. The iliotibial band, so the ilium tibia, hence the name iliotibial band, goes from the ilium, comes down the lateral thigh, and it ends up going into the tibia. There's some controversy about the IT band. Some people say it cannot be released because it's got a tensile strength of steel. Some people say it's a waste of time massaging it, working it. There's two schools of thought. But in my opinion, the IT band doesn't necessarily have to be compressed to be released, but obviously due to the location of this band, this fascial band, you have the hamstrings underneath and the vastus lateralis on top. So although maybe this band doesn't need to be compressed, it needs to be moved left and right to in order more sliding surfaces of the muscles in its origins. So I'm going to show you a couple of different ways of getting into the IT band. So first of all, I find a greater trochanter. Kiki lifts her leg up towards me and she relaxes. She lifts again. So when she lifts, I feel some tension just about here. So she lifts, she relaxes. So I want to be in and around that line of tension. On real muscular dense clients, you'll see a divot on their lateral thigh. That's the IT band. So first of all, I'm just going to use finger pressure. I'm going to work down from the trochanter, just like so, all the way down. Note the angle of my pressure here. I'm pushing down at a 45-degree angle, maybe even steeper. So this can be tender, but it's not as tender as this. That wasn't planned either. So the angle is key. We're trying to increase the ability for this band to slide. We're not trying to compress this band. It's generally already compressed due to the anatomy and the tautness of this band. So I'm using extended thumbs and I'm scanning all the way down. Then what I'll do, I'll come on the posterior side of the IT band and I'll push obliquely inward. So I'm pushing, the IT band is say here, and I'm trying to push it this way. So I'm trying to roll this band forwards, this way. So this is hamstring, this is IT band. So I'm pushing this way. So we're trying to separate adhesions between the IT band and lateral hamstrings in this case. Vastus lateralis, the biggest quad muscle of the four. Now I want to push the IT band this way. So here I'm using fingers and thumb. Again, notice my angle. It's towards Kiki's knee and across. This way. So in Kiki's case, there's a sore spot. Here, you already see her wincing. And I'm not applying much pressure. So in this case, what I would do, I would hold this pressure, and I say straighten your leg and bend. Keep your knee still, just straighten your knee and bend it. Straighten the knee and bend. So relax, don't move your knee from this position. There you go. Because I want them to stay relaxed. If she lifts her knee off her knee, the IT band tenses up on me. So I want to keep the IT band somewhat relaxed. So what's happening here, guys? There's some movement. The quad's going to do this around the IT band. And that's how we release fibrosis and adhesions. Go again. Come back. Go again. 2 more. 5 to 6 reps generally. Relax. When you're working on bigger clients, you can use an elbow, and I use the soft part of my ulna. But again, it's always the same principles. Very rarely do I come up and push down like this. It's always this way, and or trying to create shear. So in in this scenario, I'm working the posterior side of the iliotibial band. I always use my reference as the trochanter here. So it's like I'm trying to soar forward, you see, this way. So I'm working across the IT band as opposed to down, this way, this way. Same if I'm doing the front piece. Try not to go back to the camera. So I'll be working across this way, pushing the IT band forwards, forwards. With most tissues in the body, it's great to work them in a somewhat shortened range, sometimes a really short range, and of course it's good to work muscles at a lengthened range. So we can just as easily have Kiki's leg off the side of the table and work the IT band this way, with the same principles I just described. Note from the previous technique, the QL, so when you're stretching the QL, this is how you piece these techniques together and make it more of a flowy type of massage. So QL is, the IT band, there's a lot of controversy surrounding it. I believe it should be released, it should be moved, it should be mobilized, but I don't believe it should be pummeled to death. And when you are, if you are working with someone who has a real positive oversight, a real shortness in the IT band, and they are having some lateral knee pain, some sort of like trochanteric bursitis type symptoms, and you do feel it's advisable to really get in and release the IT band, I would suggest very long sustained holds. Because it's so fibrous and so collagenous, this tissue, we need to be here for like 2 to 3 minutes to really allow that change to happen. So if you are going to release the IT band with a lot of pressure, be prepared to be in the same spot for several minutes, guys. Here. So the work should look like this. Nothing's much happening really, but take your time. You can take 5 to 6 minutes working down the IT band, both sides.